Your medical team has discussed with you the importance of having a central line placed for your treatment. You may have many questions and concerns regarding the care of the central line. Our goal in this video is to help ease your concerns and answer your questions on central line care. A central line is a catheter inserted into your arm or chest into the large vein leading to your heart. This catheter can be used to give you fluids, medications, and blood products. It may also be used to draw blood. Central line dressing changes are to be done every 7 days and anytime the dressing becomes wet, loose, or soiled. The BioPatch is a protective disc to help reduce infection and should be changed every time your dressing is changed. Depending on your insurance, you may have a home health nurse come to you once a week to change your dressing. If this is not available to you, you will have to have a family member or friend assist you. First, prepare a clean workspace area on a stable, non-porous surface. Gather supplies: the central line dressing kit, a pair of clean gloves, the BioPatch. Clean hands thoroughly with antibacterial soap or an alcohol-based hand sanitizer. Remove the kit from plastic packaging, placed in your workspace, and open one flap of the kit without touching the inside of the wrapper. First, put on the face mask, and then clean gloves. Place the face mask on the person with the central line. Remove the old dressing and BioPatch carefully. Do not pull on the catheter or touch the exit site. Look at the site for redness, drainage, pain, and bleeding. Call your healthcare provider if you notice any of these signs after completing the dressing change. Remove gloves and wash hands with antibacterial soap or hand sanitizer. Completely open your dressing kit without touching the inside of the wrapper. Carefully, without touching anything else, remove the sterile gloves from the dressing kit. Open the BioPatch packet and carefully drop the BioPatch into the open dressing kit and place the packet off to the side of the sterile kit. Open the sterile package of sterile gloves by using the flaps surrounding the package like a book. The left and right symbols should be facing you. Grab the first glove by the outside of the cuff and slide your palm into the glove with your thumb facing outward. Grab the second glove by sliding the 4 fingers of the hand that now has the glove on inside the cuff of the second glove. Slide the ungloved palm with your thumb facing outward into the glove. Now you are sterile, germ-free. You should not touch anything besides the inside of your sterile dressing kit. Activate the ChloraPrep applicator by squeezing the 2 wings on either side of the handle together until you hear a snap. With the applicator, using a back and forth motion for 30 seconds, clean the catheter exit site and the surrounding skin covered under where the dressing was. This area will be approximately 4 inches by 5 inches. Using your tweezers in the kit, lift the catheter away from the skin and cleanse the catheter with the ChloraPrep applicator and cleanse the skin under the catheter. If you do not have tweezers in your kit, use one hand, the clean hand, lifting up the catheter, and the other hand, the sterile hand, cleansing the catheter with the applicator. Drop the ChloraPrep applicator and tweezers off to the side away from the sterile dressing kit. Allow the area to dry completely for at least 30 seconds. It may take up to 3 minutes to dry. Do not wipe, blot, fan, or blow on the site. Place the BioPatch disc around the catheter. Make sure the blue side is up and the slit is slightly turned to the side, ensuring the skin underneath is completely covered. Apply the dressing by removing the back of the paper lining to expose the adhesive and place the dressing over the exit site with the window in the center. Smooth the entire dressing surface from the insertion site out towards the dressing. Now slowly peel the paper frame from the edge while applying pressure to the dressing. Remove the larger securement tape strip from the liner and lift the lumens of the catheter and apply the tape strip underneath the catheter. Apply the smaller tape strip on top of the dressing where the lumen meets the central line dressing. Call your healthcare provider immediately for any of the following: fever of 100.4 or greater, or chills, swelling of the face, neck, or arm, drainage, redness, swelling, severe pain or bleeding at the exit site, difficulty flushing the catheter falls out all of the way or part of the way, damage to the catheter such as a leak, hole, or crack. Important safety tips: always wash your hands before touching your catheter. Never use scissors near your catheter. Carry an extra sterile cap and alcohol pads with you in case the cap falls off. Use tape and plastic covering over the clear dressing before showering and remove plastic covering after showering. Call the home health nurse if the dressing becomes wet, loose, or soiled. If no nurse is available, change the dressing if you have been trained. Do not change your own PICC dressing because the PICC dressing is not sutured. Always clamp the catheter when not in use. Plan ahead so you do not run out of supplies. We hope that this information will assist you in caring for your central line. This can be a difficult time in your life, and we want to be there to help. Please contact your healthcare team with any questions.